And we're back in action. James Garrity, our pharmacist, live in studio. We have a big one coming the way now, James.
Yes, John.
Would you be able to advise a supplement for someone suffering from chronic fatigue and feeling very weak? No energy, affecting daily life. Past 2 years have included COVID and a high pylori stomach infection, chronic fatigue since, very weak immune system I seem to have. I'm so tired and I'm experiencing mucus and tonsil stones in the morning on my right side of my throat. I've been on Galfer for the last few months, but extremely low energy, which affects daily life. I'm also taking Revive for the last 2 months. I also have high cholesterol. Any advice would be great in relation to supplements or tests should I get carried out, says Teresa. A lot going on there, James.
That's a big question, and I'll do my absolute very best here to give the lady some direction. My heart goes out to Teresa because obviously she's got that chronic fatigue which seems to be prevalent, especially if she had COVID as well, didn't she?
Yeah,
Ger?
a lot COVID.
And the H. pylori as well.
H. pylori, stomach infection, mucus, what are tonsil stones, James?
Sometimes when you swallow, Ger, and sometimes you can get that feeling. It's like an inflammation at the that's it, and it's really if
sore.
they get really sore,
Yeah.
Ger, and it's usually a sign where the body is compromised immune wise. And we can also see there as well, Ger, like I would definitely be recommending that she changes from the Galfer, because that might be upsetting her tummy, onto something like Easy Iron. She'll get that in any pharmacy or health food store, just pop in, or Spa Tone or one of those. What I would recommend there, Ger, and we can see her high cholesterol. It's important. I'm going to say this, and I know I say it ad nauseum, Jerry, but it's important that she has a chat. Make sure that she's in constant contact here with her GP. Yeah, that's important. High cholesterol, H. pylori. Now, for the H. pylori, there's a specific test you can do for that.
What's H. pylori?
H. pylori is a bacteria, an anaerobic bacteria that lives in the stomach lining and causes a lot of irritation. It was discovered, I'd say, about 35 years ago by a British researcher based in the northwest of England.
Okay.
And what he discovered was that this particular, I think he won the Nobel Prize for it, Ger, but what he discovered was that this particular bacteria was causing a lot of irritation and upset in stomach. But there are 2 antibiotics and a proton pump inhibitor that you can use for about 6 weeks. That combination gets rid of it. So she needs to know, we need to know as well, has she taken that treatment? Okay. Has it worked?
Right.
And why is she mentioning it's H. pylori stomach? Because there's a lot going on there, Ger. But what I would say to her here is the fact that she's taking she mentioned there that she's taking some Revive, did she, Ger? I'm also taking Revive.
I'm also taking Revive for the last 2 months.
I would strongly recommend to boost her immune system. If she pops into, we have it anyway in our stores, Zell Oxygen, Zell Oxygen. If she's based near Ballina, she calls into the wonderful Martina in Garden Street, or the wonderful Noel up in Bunray. They're very familiar with the basis of Zell Oxygen. And another product called Multifiber Plus, just to help the gut area there. And that will also promote a better absorption of the Revive product. Okay, so we're looking there at boosting her immune system with the Zell Oxygen, the Multifiber Plus to help with her gut. The H. pylori needs to be checked with her GP.
Right.
Yeah. The Galfer, I would recommend changing that to Easy Iron because it won't cause any constipation or tummy upset. She pops into her pharmacist or her health food store and gets some Easy Iron or Spa Tone. That will act effectively on that, and that should hopefully put her on a good step to get her back to full health.
And good luck to Teresa.
Absolutely, that's a big
question.
That's a big question, Jared. But
yeah.
What I would say, and this is really important, Jared, that sometimes in the darkest moments, when you're feeling with chronic fatigue and you're really, really struggling, is just to start on that and start easy and just work from there.
Now, a gentleman in his 40s had a heart attack a few months ago. It turns out the cause of it was lipoprotein A. Is that right?
Yes.
No. So therefore, what is lipoprotein A?
There are different types or subsets. What we were talking about, the LDLs, LDLs, HDLs. So there's different subsets.
Cholesterol.
Around that area, Jared, fats and subfats and that.
So because this gentleman had that heart attack as a result of that, James, this caller is wondering, would you recommend now that the rest of the family get tested?
That's a conversation for their GP or consultant, Jared. That's very important because you're going down the road there of genetics, you're going down the road there of family histories, all of that. And that needs a sit down with their GP and have a conversation around that.
Take it from there.
But the fact that it was identified that it was a lipoprotein, the person was in their 40s, they need to have that conversation.
Okay. A woman in her 70s, James, low in estrogen. What can you recommend?
Well, usually with low in estrogen, usually there's a recommendation, there's a test done to see how low they are. And usually with the side effects, she's probably, could be difficulties with urinary tract infections, painful sex, dryness in the vaginal area. And usually the HRT, hormone replacement therapy, could be a recommendation. But again, there's specific tests that needs to be done around that, and a conversation with her GP will be able to help with that, because now you've got the new scheme coming in. You've also got the fact that there's patches, there's vaginal estrogen as well. So we've got all of those. So there's good products out there, Ger, but it just needs a little bit of direction. I would definitely recommend for a conversation for that lady with her GP.
To take it from there.
Yep.
Both my husband and myself are getting short, sharp jabs in our legs and our feet. This started after we got COVID. We're now in our 70s. Must be jabs of pain, I presume.
Yeah, and that's what they're saying, Ger. And if we just start with something nice and basic there, with some maybe vitamin B complex and magnesium, just for a couple of months, and just see how that goes, because sometimes it's just a case of re-establishing good lines of communication within the body, especially along the nerve lining, and just taking a little bit of B complex and magnesium can sometimes help with that.
Okay.
Because the COVID virus has been shown to do a lot of damage, especially in viral area, around taste, chronic fatigue syndrome.
Yeah.
So we've got a lot of issues there, this idea of long COVID and the side effects of that. So it's about how do we manage that? How do we get supplementation or medicines that can actually benefit the patient?
Okay, now cholesterol is big today. Good morning, James. Recently I had my bloods done. My cholesterol was over 7, which I didn't expect, as I do everything right in that line. I'm not on any statins. All my other bloods were excellent. Any recommendation to lower my cholesterol, says Mary?
Well, Mary, that's a good question. I'm just curious to know as why you weren't put on a statin.
At 7.
Yeah? At 7, yeah. Now, obviously, the doctors have the reason, but I would definitely recommend if Mary popped into a health food store or pharmacy and just got herself, I'd go with 3 things, just for about 3 months, Ger. Resveratrol, what would I go with? Xerocol and Multifiber Plus for 3 months.
All over the counter.
All over the counter. And okay, we do talk a lot about diet on the program, Jerry, and you don't have to break the bank with the diet or whatever. Just manage it, increase the hydration, just watch the overly processed foods, and go with those 3. So what do we say, Jerry? Resveratrol, Xerocol. No, not Movicol, Jerry. So we'll go back again.
Yeah.
Resveratrol,
Yeah.
Xerocol, and what was the other one, Jerry?
Go ahead, James. Resveratrol.
Multifiber
Plus. Yeah.
Plus.
Okay.
So if we go on them for about 3 months, Ger, and she comes in, if we get a test done, I have to apologise, Ger. A number of people that were looking to get their cholesterol tested with me, and my machine broke down. I had to get a new one. I have to get it revalidated, but I should have it done this week. So I know there's a number of people I have to ring, but once I do,
You'll be up
I'll be up and running. I will give them a ring.
So we'll ask one more question now in this section, and then we'll go on to Facebook in part 2. I've had a sty in my eyelid now for the last 4 months. What's the cause of it? My friend tells me that I could be ran down. Any advice?
They should be popping into the pharmacist, Ger, and just getting some Broline ointment and pop it across the eye, and maybe get some Blephiclean eyelid cleaners, and just clean the eyelid with the Blephiclean and put a little bit Broline eye ointment on it at night time. If that's not working after 7 days, they have to see the GP.
Is it a case that they could be run down?
They could possibly be run down. Sometimes, you get, say, cracks on the side of your lips, you're getting styes, you're getting... you're not feeling the best. You could be run down, Ger. But, it's important here we get this cleared up. Is there an infection along the eyelid, or
an underlying cause?
An underlying cause. But it can be cleared up, and if it's returning, then, it needs to, an optometrist to check it, or to check with the GP.
Perfect. All right. Now, so that's where we hold it now for this point. 096 60072 if you're going to leave us on the radio. That's 096 60072. Or the website, James, is
www.malloyspharmacy.com.
That gets it. All right. Thank you, James. And you're back next month with God's help. What I want to say is that we'll now go to Facebook and we'll answer the rest of your questions on Facebook. In the meantime, I'll talk to you on the radio tomorrow with God's help. Take care, and thanks to the team.
Thanks.
The Mid-Morning Show on Midwest Radio. Thanks to Harrington Concrete and Quarries, leading supplier of high-quality grow lime, delivered and spread right across the Connacht region. Now is the time to lime at harringtonconcrete.ie.
Discover the stunning Wild Navan National Park this summer. Hop on our free shuttle bus running Tuesday to Saturday this July and August between Westport and Bangor Erris. Enjoy the breathtaking
This,
scene.